Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about heel spurs or calcaneal spurs. So let me give you a little bit of background first. So these are the bones of the foot on x-ray. This is the calcaneus, which is why it's called a calcaneal spur. That's the bone of the heel. So your heel's sitting right here, and the bone that makes up that heel is the calcaneus, so you get calcaneal spurs. So there are two types of calcaneal spurs that people talk about. Well, three really. I'll talk about the third one here in a second, but two primarily that people are talking about. One is the plantar heel spur. When people come in with plantar fasciitis, they're saying, okay, I have a heel spur. That's the reason my foot hurts. And that's not completely correct, so I'll come back to that in a second. The other is the retrocalcaneal, or the back of the heel spur. The third one is what we call a Hagless deformity. So I'm going to talk about all three a little bit today, so to help you understand. So number one, the heel spur at the bottom of the foot, the plantar heel spur. Plantar heel spurs do not cause pain. We used to take them out. What we found over time is we were solving the problem by taking these heel spurs out because we were cutting the plantar fascia, because the problem is the plantar fascia. Plantar fasciitis is really the big issue. It's not the heel spur itself. So what you've got the Achilles tendon that comes down and attaches here. You've got the plantar fascia that attaches here, goes out to the toes. And because of the pull on that plantar fascia with plantar fasciitis, you get a spur in that area. You get the heel spur on that area, because what the body does is it basically creates the issue where it's actually going to cause, so it starts to create a spur because you're pulling on that area. And that spur is really what's going on here, right there. So you get that heel spur, you get the growth there, or the spurring, but because it's parallel to the ground, it doesn't cause pain. You don't have to treat them. I have lots of people with these heel spurs never having pain. So when we treat the plantar fasciitis, then we actually solve that problem just by getting rid of the pull on that, and you don't get the spur anymore. So, or you don't increase the spur, the spur doesn't get worse, it doesn't cause the pain. The alternative is that retrocalcaneal spur, that big spur on the back of the heel. These do cause pretty significant pain. They usually rub on shoes. They usually cause pressure there in the Achilles tendon. They can cause the Achilles tendon to swell up and get the Achilles tendonitis. They cause pretty significant issues. So most of the time we have to go in and actually take that spur off. So the problem with that, if you're doing that kind of surgery, it sits right in the middle of the Achilles tendon, so you end up having to cut the Achilles tendon, or open up the Achilles tendon and clean it out and then reattach it there in that area. So that's a big deal. It can be treated, and if you're having pretty significant pain, that's a good idea. The third one, like we said, is the Hagless deformity, which is a prominence on the back of the heel, top of the heel. Typically, it'll be on the lateral side, on the outside of the foot, that will rub on shoes as well, and it's just a big bump. The advantage of this is the Achilles tendon sits in front of, sits right here, so the spur sits in front of it, so you can actually go in from the side. You can actually remove that without treating or without cutting the Achilles tendon, so it can be treated as well. So if you have a heel spur, or if you have a possibility of a heel spur, it's a good idea to get an x-ray and get evaluated and decide if you need to do some treatment. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 336. Heel spurs or calcaneal spurs, and what your options